Hello friends, hi, a very good morning to one and all. Welcome to my channel, The Voice of Nurse. Today we are going to discuss continuous topic part 3 from the previous year model paper. We already discussed in part 1 and part 2 in previously we already discussed continuous 60 questions in previous year's model paper. Now we are going to discuss part 3 from the 61 question to 100 questions. 40 questions we will cover in this video. We will discuss in detail about 40 questions. Before moving on to topic, a small request friends. Anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification. Please share the video to your friends and please give a comment. Let's move on to topic. Today we are going to discuss previous year model paper part 3 from the question number 61 to 100 question. But before discussion of the today topic, two members want to discuss regarding question number 50 in part 2 video regarding gigantism, acromegaly and Addison's disease and Cushing's disease. In detail about these diseases, please explain me like that. I got a comment from the my dear viewers. So I will discuss this question first, then we will move on to today's content. Fifth question, hyperfunctioning of anterior pituitary in prepubertal children causes. The hyperfunctioning of anterior pituitary gland the prepubertal children causes which of the disease from the options? We will see here options. Option A, gigantism. Option B, acromegaly. Option C, Addison's disease. Option D, Cushing's disease. The low secretion of somatostatin means it does not inhibit the growth hormone and abnormal growth of the body changes is called as gigantism. Detailedly I will explain here. Gigantism means, option A, gigantism means is a very rare condition that happens when a child or adolescent has high level of growth hormone in their body which causes them to grow very tall. So gigantism means the growth hormone is increases in the body that leads to grow very tall structure in the body. This is gigantism. One more thing I have to add. Gigantism opposite word is dwarfism. Dwarfism means opposite to the gigantism, short structure due to the genetic disorder or medical disorder. Here we discussed gigantism. Next we will discuss acromegaly. Acromegaly, option B. Acromegaly is a hormonal disorder that develops when the pituitary gland produces too much of growth hormone during the adulthood. During the adulthood, the pituitary gland releases the high hormone, leads to acromegaly. Symptoms of acromegaly includes enlarged face and hands. This is acromegaly. It is a hormonal disorder, develops a pituitary gland produces too much of the growth hormone during the period of adulthood. This is acromegaly. Next we will see here option C, Addison's disease. Addison's disease is a disorder in which the adrenal gland don't produce hormone, means lack of hormone in the adrenal gland. So here the Addison's disease is a disorder which adrenal gland don't produce hormone is also called as hypocortisolism. Hypocortisolism is a term Addison's disease. Insufficient amount of hormone cortisol and sometimes aldosterone. This is Addison's disease. Next we will see here Cushing's disease. Cushing's disease is a condition that occurs from the exposure to high cortisol levels in long time, means it is opposite condition to the Addison's disease. In Addison's disease, lack of cortisol. Here Cushing disease, too much high cortisol levels for long time in the body is called as Cushing disease. Common cause in the use of steroids drugs and overproduction of cortisol by the adrenal gland is called as hypercortisolism. Here option D, Cushing disease also called as hypercortisolism. Here hyperfunctioning of anterior pituitary in prepubertal children causes a very rare condition happens when the children and adolescents is a gigantism. Option A is the correct answer here. Why? Because of The high level of growth hormone in their body which causes them the growth tall, very tall, is gigantism. Here option A is the correct answer. Okay friends, clear? Next we will discuss today topic from the continuation. Part 3, 61 question. All the following are associated with increased chance of acquiring HIV infection in women except. From the option, one is the except increasing chance of acquiring HIV infection in women. We will see here options. Option A, chlamydia infection. Option B, bacterial vaginosis. Option C, herpes simplex infection. Option D, trichomonas vaginalis infection. Chlamydia infection, bacterial vaginosis and herpes simplex infections are most common chances to get the HIV infection in the women's. But here option D except. Why? Trichomoniasis may increase the risk of getting or spreading the other sexually transmitted infections. For example, trichomoniasis can cause genital infection or inflammation that makes it easier to get infected with HIV. Trichomonas vaginalis infection is a anaerobic flagellated protozoan parasite and it is a causative agent for trichomoniasis, which is a sexually transmitted disease. So there is a reduced risk of acquiring the HIV infection due to this reason. So here option D, trichomonas vaginalis infection is the except increased chance of acquiring HIV infection in the women. Signs and symptoms is different in the males and females. We will see additionally here the signs and symptoms of, first we will see in men. Itching or irritation inside the penis, burning after urination and redness around the penis. And we will see here in females. In symptoms of in females, itching, burning sensation, redness, discomfort with urination and vaginal discharges can be clear or white and yellowish color, and also sometimes it is a greenish color. Here so the option D, trichomonas vaginalis is a except chance of acquiring HIV infections in women. Next we will move on to question number 62. Nurse engaged in suction process of tracheostomy in situ patient who requires frequent suctioning. How long she should do suctioning every time? The nurse engaged in suctioning in a process of tracheostomy patient. Requirement of frequent suctioning and how long the nurse should do suctioning every time from the following options. We will see here options. Option A 15 seconds, option B 30 seconds, option C 45 seconds, option D 60 seconds. A prolonged suctioning can lead to hypoxia and bradycardia. Suctioning for 10 to 15 seconds. Suctioning can prevent hypoxia and good suctioning will improve the breath sounds and tidal volume, decreases the secretions and maintaining a SpO2, and repeated suctioning may improve the saturations of the patient, correct saturations levels of the patient. In detail about this question number 62 regarding suctioning we already discussed in nursing foundation, question number 85. So here option A 15 seconds is the correct answer. The nurse have to do suctioning in this 15 seconds time only, because we have to prevent a hypoxic condition and patient may undergo bradycardia. So we have to prevent those complications. That's why we have to do in 15 seconds. Next we will move on to question number 63. A lethargic patient has fever, vomiting, headache and the nurse has to prepare him for which one of the following procedure? Actually patient is an lethargic, fever, vomitings and headache. So nurse have to prepare from the following options. Which of the procedure nurse have to prepare patient to be done? Options. Option A blood culture, option B lumbar puncture, option C CT scan and option D ultrasound. Only we can see here in this question some of the complications of meningitis is there: lethargic patient and vomiting, fever, headache. These all are the complications of the one of these causes to the meningitis. So for this condition we can arrange or we can prepare him for the lumbar puncture. Option B is the correct answer here. 63rd question we already discussed in the previous videos nursing foundation. Question number 74 we already discussed regarding meningitis and procedure lumbar puncture in detail. Just check it once in medical surgical nursing point of view. Question number 74. Next we will move on to question number 64. Which of the following actions would a nurse take first when caring for a patient experiencing a cardiac arrest? First, taking care of the patient experiencing cardiac arrest. So what is the first action nurse have to take? We will see here options. Option A, initiate cardiac monitoring. Option B, provide IV access. Option C, establish an open airway. Option D, obtain a pulse oximetry reading. In order to manage the patient with a sudden onset of cardiac arrest, a nurse should do ABC, airway, breathing, circulation. Most vital role in cardiac arrest patient. Airway must be open so that the air containing oxygen must enter the body. Breathing must be take place so that oxygen passes through the lungs into the bloodstream. The heart must be circulate the oxygenated circulating blood. So here's ABC means airway, breathing, circulation done. So here establish an open airway is the correct answer. Next we will move on to question number 65. Maternal death rate is expressed death per. Means maternal death rate is expressed deaths per. We will see here options. Option A, 1000 live births. Option B, 1000 pregnancies. Option C, 10,000 live births. Option D, 10,000 pregnancies. The maternal mortality ratio is number of maternal during a given time period per 10,000 live births the same time period. So here option C, 10,000 live births is correct answer. Maternal death rate is expressed death rate per 10,000 live births. The MMR main causes are hemorrhage, septicemia, toxemia, abortions, ectopic pregnancy, and also malpositions of the fetus. Here these all are the causes for the MMR. So here maternal death rate is expressed death per 10,000 live births. Option C is the correct answer here. Next we will move on to question number 66. Which type of solution causes water to shift from cells to plasma? Which of the solution causes water to shift from cell to plasma? We will see here options. Option A, alkaline. Option B, isotonic. Option C, hypotonic. Option D, hypertonic. We will see here options in detail. What is alkaline? Alkaline means having a chemical behavior opposite to an acid. Means alkaline is having a chemical behavior opposite to an acid. Here we will see option B, isotonic. What is isotonic means the water moves out of the cell until it reaches to equilibrium, becomes isotonic. So isotonic means the water moves into the cell until it reaches into the equilibrium and becomes a isotonic. This is alkaline and isotonic. What is hypotonic? Hypotonic is a solution causes water to shift from the plasma to cell. But here in this question water to shift from the cells to plasma. So hypotonic is water to shift plasma to cell. So opposite direction. So option D, what is option D, hypertonic. Hypertonic means the solution causes water to shift from the cell to plasma is called as hypertonic. So here option D is correct answer. Detailedly we will see here. A hypertonic solution causes water to shift from cell into the plasma. The water flows through the membrane from a high to low concentration. The process is called as osmosis. Here the process is called as osmosis. So here option D is correct answer. Next we will move on to question number 67. How long should a nurse wait after taking cold milk for recording oral temperature? After taking cold milk, the nurse have to wait how much time for recording a oral temperature? We will see here options. Option A, 5 to 10 minutes. Option B, 10 to 20 minutes. Option C, 20 to 30 minutes. Option D, 30 to 40 minutes. Question 67th question we already discussed in the nursing foundation. Question number 65 in detail about this question is present in nursing foundation? Question number 65. Just check it once, friends. Here option C, 20 to 30 minutes is the correct answer. Nurse should have to wait for 20 to 30 minutes after taking cold milk for recording oral temperature. Here option C is the correct answer. Next we will move on to question number 68. Which nursing diagnosis is most appropriate for patient with chronic venous insufficiency? Quality of nursing diagnosis, patient is having chronic venous insufficiency. We will see here options. Option A, activity intolerance. Option B, body image disturbed. Option C, fluid volume deficit. Option D, skin integrity impaired. So we have to know first what is chronic venous insufficiency. Chronic venous insufficiency is a condition that occurs when the venous walls in the legs veins are not working properly, making it difficulty for blood to return to the heart from the legs due to the status of blood in the particular area of the patient may have impaired skin integrity. So here option D is the priority nursing diagnosis for the chronic venous insufficiency. Option D, skin integrity and impaired. Signs and symptoms of chronic venous insufficiency are swelling in lower leg and ankles, tiredness in the legs, lethargy and also itching skin on the legs or feet, and impaired skin integrity also is there. Next we will move on to question number 69. 30 years old female complained of wetting her dress while coughing. Which one of the following conditions a nurse should suspect? Here 30 years old female complaining wetting her dress while coughing. When they are coughing, they are having wetting in the dress. Means urine leakage is there. Which one of the following conditions nurse should suspect? We will see here options. Option A, cystocele. Option B, rectocele. Option C, enterocele. Option D, urethrocoele. Discuss in detail about these all are the options. What is cystocele? Cystocele is a bulge of the bladder into the vagina. Nothing but bladder hernia. Cystocele means bladder hernia. Next, we will see rectocele. Option B, rectocele. Rectocele is a posterior vaginal prolapse, is also known as rectocele. This is the rectocele. Next we will see option C, enterocele. Enterocele is small bowel prolapse, also called as enterocele. Means small bowel prolapse is there in enterocele. What is urethrocoele? Urethrocoele is a urethral prolapse. A type of pelvic organ prolapse is urethrocoele. Here the wetting her dress while coughing means we got a cystocele, that bladder hernia. Option A is the applicable here. Finally we will see cystocele. Cystocele is a bulge of the bladder into the vagina, means bladder hernia. The signs and symptoms of cystocele is feeling that something has dropped out of the vagina and leaking of urine, or feeling of emptying the bladder, and urinary incontinence is present in the cystocele. And causes of the cystocele are heavy lifting, chronic coughing, constipation, obesity and menopause. So here option A, cystocele, is applicable here. The 30 years old female complained wetting her dress while coughing is cystocele. Option A is the correct answer. Next we will move on to question number 70. Benefits of breastfeeding include all except. The benefits of breastfeeding included in the options. One is the accept. We will see here option. Option A, it provides nutrients. Option B, high level immune protection. Option C, less prone for gastrointestinal infections. Option D, it provides adequate iron for premature newborn. Human milk contains little iron, so infants who are exclusively breastfed are at increased risk of iron deficiency after 4 months of age. The breast milk provides ideal nutrition for bodies and contains an almost protect of vitamins and proteins and also fat, especially colostrum. Colostrum provides high amounts of immunoglobulins IgA, immunoglobulin A, as well as may other antibodies. So here option A, the breast milk's benefits are it provides nutrients, colostrum provides high level of immune protection and less prone for gastrointestinal infections. But here option D is the except. It provides adequate iron for premature newborn is the except benefit for the breastfeeding. Here option D is the accepted. Next we will move on to question number 71. Which IUCD needs to be replaced only after 10 years? IUCD means intrauterine contraceptive device, nothing but intrauterine contraceptive device. Which IUCD needs to replace only after 10 years? We will see here options. Option A, copper T200. Option B, progesterone. Option C, CUT 380A. Option D, Nova T. We will see all of the options. Copper T200. It is effective for 3 years. Copper T200 is effective for the 3 years. Progesterone. It is a uterine therapeutic systematic for long-term contraceptive for the 1 year purpose. Next option C, CUT 380A. A primarily works by disrupting sperm mobility and damaging sperm. The copper T380A or copper T intrauterine device is a safe and trusted birth control device to ease unwanted pregnancies used for a period up to 10 years. So here option C is the correct answer here. Next, what is Nova T? Nova T is intrauterine device type we can use for the 3 years. The duration of Nova T is 3 years only. So intrauterine contraceptive device needs to replace it only after 10 years is option C, CUT380A. Next we will move on to question number 72. Oxygenated blood enter the fetal circulation from umbilical vein via means the oxygenated blood entered to the fetal circulation from the umbilical vein through the from the options. We will see here options. Option A, ductus venosus. Option B, ductus arteriosus. Option C, intrahepatic vein. And option D, intrahepatic artery. Option C and option D, intrahepatic vein and intrahepatic artery, those both are related to the liver, hepatic system. Here, thus fetal circulation umbilical vein via ductus venosus or ductus arteriosus. We will see here what is ductus arteriosus. Ductus arteriosus is connects main pulmonary artery to the aorta. Here, the blood is circulation connect from the pulmonary artery to aorta. Pulmonary artery to aorta. What is ductus venosus? Option A, ductus venosus is connects to the umbilical vein to inferior vena cava. So oxygenated blood enter the fetal circulation from umbilical vein via ductus venosus. Option A is the correct answer. It connects the umbilical vein to inferior vena cava. Additionally, we will see here ductus venosus in detail. Oxygen and nutrients from the mother's blood are transferred across the placenta to the fetus through the umbilical cord. This enriched blood flows through the umbilical vein toward the baby's liver. There it moves through a shunt is called as ductus venosus. It connects the umbilical vein to inferior vena cava. Next we will move on to question number 73. Which one of the following viruses cause post-transfusion hepatitis? Post of the transfusion hepatitis. Which of the virus cause from the options? Options. Option A, hepatitis A. Option B, hepatitis B. Option C, hepatitis C. And option D, hepatitis D. What is hepatitis? Hepatitis is an inflammatory condition of the liver. Post-transfusion hepatitis is the most common disease transmitted by blood transfusion and it has major health impact. Nearly all cases of non-A, non-B post-transfusion hepatitis are characterized by C, hepatitis C virus. So here option C is the correct answer. Hepatitis C is a liver infection characterized by hepatitis C virus. Hepatitis C is a spread through the contact with blood from an infected person. So here option C is the correct answer. The signs and symptoms of hepatitis C: fever, fatigue, loss of appetite and nausea, vomitings, abdominal pain and dark urine, and also joint pains and some of the times jaundice. Here hepatitis C is the post-transfusion hepatitis C virus. Next we will move on to question number 74. What is the casual site of intramuscular injection a nurse will choose in an adult for Z-track technique? Which of the site of intramuscular injection nurse will choose in adult Z-track technique? We will see here options. Option A deltoid, option B rectus femoris, option C ventrogluteal, option D vastus lateralis. Here, Z-track method is a technique in which the provider slightly pulls and holds the pressure on the skin when giving the injection, which leaves a zigzag path. After removing the hand, we can see the Z-track technique. The ventriculogluteal is the usual site of intramuscular injection a nurse will choose in adult for the Z-track technique. Sites of intramuscular injection administration is deltoid and ventrogluteal and also vastus lateralis. So here in the adult for Z-track techniques we can choose, the nurse can choose option C ventrogluteal. Z-track technique we can see through the insert the needle at the angle of 90 degrees angle, slowly depress the plugger and inject the medications and release the skin slowly. We can see the Z-track technique and the area of the ventrogluteal. Next we will move on to question number 75. A newly married healthy couple is asking for the best method of contraception and which one of the following methods a nurse will advise. Newly married couple asking best method of contraception. Which one of the following the nurse will advise? We will see here options. Option A barrier method, option B rhythm method, option C intrauterine device, option D combined oral pills. The perfect use effectiveness rate is above 99% awesome, but they have to remember to take the pill at the same time every day. If missed a day or takes different time, it reduces effectiveness of the oral pill. Here option D is the correct answer. Combined oral pill, best method of contraceptions of newly married healthy couple. Is oral contraceptives medicines taken by mouth to prevent pregnancy, also called as birth control pills. These are the best contraception pills for newly married couples. So here option D is the correct answer, combined oral pills. For example, for the oral pills, mifepristone oral pill for the best contraceptive in the newly married couple. So here option D is the correct answer. Next we will move on to question number 76. Persistent generalized lymphadenopathy is caused by. The persistent generalized lymphadenopathy is caused by. We will see here options. Option A HSV, option B HZV, option C HAV, option D HIV. HSV, we will see the abbreviations of these options. HSV. HSV means herpes simplex virus. HZV means herpes zoster virus. HAV means hepatitis A virus. Option D we know HIV. Here the persistent generalized lymphadenopathy. There are the several potential causes for the lymphadenopathy ranging from the infections, autoimmune and malignant and also lymphoproliferative, several potent causes. The persistent generalized lymphadenopathy is enlarged, painless, non-tender lymph nodes occurring in the different areas for more than 3 to 6 months, for which no other reason can be found. This condition occurs frequently in people in the latent period of HIV or AIDS. So here persistent generalized lymphadenopathy caused by HIV. Option D is the correct answer. Next we will move on to next question. Question number 77. All are high risk factors for endometrial carcinoma except. all of the high risk factors from the option except one is endometrial carcinoma risk factor. We will see here option A obesity, option B multiparity, option C diabetes, option D exogenous estrogen. Endometrial intraepithelial neoplasia is a condition that may lead to a type 1 endometrial cancer. In this condition, the endometrium grows too thick and show changes that look like cancer. Most common signs is abnormal uterine bleeding. The risk factors of endometrial carcinoma is hormonal imbalance and nullipara, old age means older age, obesity, hormonal therapy and breast cancer, etc. The multiparity has poor incidence of endometrial carcinoma. So here option B is the except for the endometrial carcinoma risk, high risk. So here option B is the multiparity is the high risk factor except for the endometrial carcinoma. Next we will move on to question number 78. A subjective feelings about what is right or wrong in psychiatric medicine is said to be. Subjective feeling about what right or wrong in psychiatric medicine is said to be following. Option A values, option B mortality, option C religion, option D bioethics. Subjective feeling about what is right or wrong in psychiatric medicine is said to be morality. Lawrence Kilberg, an American psychologist, has propounded the theory of moral development. He has made a systemic study of moral development in his theory that is categorized into the 3 levels and 6 stages. 3 levels are pre-conventional level, conventional level and post-conventional level. These all are the 3 levels, 6 stages related to the obedience, orientation and behavior driven by self-interest, social improvement and individual rights, behavior of social order. These all are the 6 stages involved in the 6 stages. So here's the subjective feeling about what right or wrong psychiatric medicine is said, morality. Option B is the correct answer. Next we will move on to question number 79. Fluid overload in a patient may cause, we will see here options. Option A angioedema, option B peripheral edema, option C pulmonary edema, option D cerebral edema. See, these all are the options. What is the meaning of option A, B, C, D? Angioedema is an area of swelling of lower layer of the skin and tissue just under the skin or mucous membrane. This is angioedema. What is peripheral edema? Peripheral edema refers to swelling in the lower legs or hands, one of the serious medical condition. Peripheral edema, one of the serious conditions, swelling in the lower legs and hands. What is pulmonary edema? Pulmonary edema is a condition caused by too much of fluid in the lungs. Fluid overload in patient may cause pulmonary edema. Here option C is the correct answer. What is cerebral edema? Cerebral edema is a swelling of brain and excess accumulation of fluid in the intracellular and extracellular spaces of the brain. Cerebral edema means this. Pulmonary edema, in detail we will see. The risk for fluid overload and subsequent pulmonary edema is especially increased in elderly with cardiac diseases. Pulmonary edema is a condition characterized by fluid accumulation caused by extravagation of fluid from pulmonary vasculature into the interstitium and alveoli of lungs. The local complications of pulmonary edema is hematoma, fluid overload, thrombophlebitis and phlebitis and so here option C pulmonary edema is the correct answer. Next we will move on to question number 80. All the following hormones are secreted by anterior pituitary except from the option one is the except hormone secreted by the anterior pituitary gland. We will see here options. Option A GH, option B GRH, option C TSH, option D FSH. We will see these all are the abbreviations. The hormones, GH means growth hormone, option B GRH means gonadotropin releasing hormone, option C TSH means thyroid stimulating hormone, Option D, FSH means follicle stimulating hormone. GH, growth hormone also called as human hormone produced by pituitary gland. GRH means gonadotropin releasing hormone released from the hypothalamus in the brain. So here option B is the except secreted by the anterior pituitary gland. TSH, thyroid stimulating hormone. Thyroid stimulating hormone is produced by anterior pituitary gland. Option D, FSH. Follicle stimulating hormone is produced by the pituitary gland in the brain. We will see about anterior pituitary gland. Anterior pituitary gland also called as master gland. Anterior pituitary gland secretes 7 hormones. GH, growth hormone, thyroid stimulating hormone, follicle stimulating hormone, and luteinizing hormone, and prolactin and adrenocorticotropic hormone, and also melanocyte stimulating hormone. So here option B is the except anterior pituitary releasing hormone, GNRH or GRH, gonadotropin releasing hormone. Next we will move on to question number 81. The nurse explains to the mother of neonate diagnosed with erythroblastosis fetalis that the exchange transfusion is necessary to prevent damage to from the options. The nurse explained to mother neonate diagnosed with erythroblastosis fetalis the exchange transfusion to necessary to prevent which of the organ to prevent damage. We will see here options. Option A, liver. Option B, lungs. Option C, kidneys. And option D, brain. What is erythroblastosis fetalis? Hemolytic disease of the fetus and newborn is called as erythroblastosis fetalis. It is a blood disorder that occurs when the blood types of a mother and baby are incompatibility. Erythroblastosis is caused due to the mixing of different Rh factors during the pregnancy. The affect fetus carrying the mother immediate exchange transfusion is necessary to prevent damage of brain. To prevent the brain damage. Option D is the correct answer here. Next we will move on to question number 82. A client with depression is taking phenelgine or Nardil medicine. The nurse advises the client to avoid consuming which foods while taking the medications. We will see here options. Option A, crackers. Option B, yogurt. Option C, oatmeal. Option D, veg salad. It is on depression, taking a Nardil medication. The nurse have to advise which type of food avoid the patient while taking the medicines. One kind of antidepressants called as MAO inhibitors and dangerous when mixed with foods or drinks that contains tyramine. These included beer, red wine, chocolates, and food like oatmeal and yogurt and cheese, and also liver and beans. So here option B, yogurt, to be avoid consuming which foods means the yogurt to be avoided while taking the medications of Nardil. So option B is the correct answer here. Next we will move on to question number 83. Which of the following is used for grading PEM? PEM means protein energy malnutrition. Which of the following scale? We will see here options. Option A, Ballard scale. Option B, Gomez scale. Option C, Bishop scoring. Option D, Kramer scale. Option A, Ballard scale is used to determine gestational age. Option B, Gomez scale is used to nutritional status of the children and weight according to weight and age. What is Bishop scoring? Bishop scoring predict how close patient is labor. This scale for the labor assessment. Kramer scale. Kramer scale defines the intensity of jaundice in children from head to hands and feet. So this is also note there. So option B is the correct answer here. Gomez scale. PEM means protein energy malnutrition may be classified according to the Gomez based on weight for the child and age also. This classification nutritional status well known widely used for the protein energy malnutrition in the children. So here option B is the correct answer. We will move on to question number 84. Flight of idea refers to. We will see here options. Option A, Pattern of rapid transition from topic to topic. Option B, repetition of words. Option C, new words invented by patient. Option D, use of rhyming words. Flight of idea. What is flight of idea? Flight of idea is a formal thought disorder. Flight of ideas occurs when someone talks quickly and erratically, jumping rapidly between ideas and thoughts. It is not a medical condition itself. It is a symptom that may occur as a part of mania and psychosis, and sometimes it is a neurological development condition. Other people may have a hard time keeping or understanding what is talking. Means that flight of ideas means new words invented by patient. People cannot understand the patient what they are talking, what they are discussing. The new words invented by the patient is flight of ideas. Next we will move on to question number 85. Which diet is commonly prescribed after intestinal surgery, during heartburn and gastric ulcers? Patient undergone intestinal surgery, post of intestinal surgery, commonly which diet is advised for the patient during having heartburn and gastric ulcers? We will see here options. Option A, liquid diet. Option B, bland diet. Option C, low fat diet. Option D, all of the above. A bland diet can be used alongside lifestyle changes to help address for the symptoms of ulcers and heartburn, GERD, gastroesophageal reflux disease, and nausea and vomiting. Bland diet is most commonly advised by the dietitian post of intestinal surgery. A bland diet includes low in fiber diet, not spicy, low fat diet, boiled food, should not eat spicy foods, and fried and raw foods, should not drink alcohol, and also avoid caffeine with drinks. So here the commonly prescribed diet for the intestinal surgery, post-intestinal surgery, and patient is having heartburn and gastric ulcers means option B, bland diet is the correct answer here. Next we will move on to question number 86. The word GOBI, G-O-B-I of UNICEF, G refers to. In the word GOBI, G refers to what? Here what is UNICEF? United Nations International Children's Emergency Fund. Here what is GOBI? GOBI means, in the GOBI, G means, we will see here options. Option A, growth chart. Option B, growth retardation. Option C, growth period. Option D, none of the above. Here GOBI means growth monitoring, oral rehydration, breastfeeding, and immunization. So here option A, growth monitoring or growth chart is the correct answer. G for growth chart. Option A is the correct answer here. GOBI means growth monitoring, promotion of oral rehydration, promotion of breastfeeding, and maintaining immunization. The aim of GOBI is improving the health of children in the worldwide according to the height and weight of percentage of infants and children and adolescents. So here option A, growth chart, G for growth chart. Next we will move on to question number 87. The client is admitted with left-sided congestive heart failure. In assessing the client for edema, the nurse should check the site. Patient is admitted with left-sided congestive heart failure. While assessing the patient edema, we have to check which site the nurse have to check. We will see here options. Option A, hands. Option B, feet. Option C, sacrum. Option D, neck. Edema of the feet and hand do not indicate central circulatory overload. So option A and B are incorrect. The neck veins should be assessed for distension in the client with congestive heart failure. So here option D, neck is the correct answer. Case of edema of the sacrum is an indication of right-sided congestive heart failure, not left side. Right-sided congestive heart failure is indicate means edema of the sacrum. So here option D, neck is the correct answer. Patient is having left-sided congestive heart failure, is assessing site for the edema. Nurse should check the neck. Option D is the correct answer here. Next we will move on to question number 88. The most commonest psychiatric disorder after head injury. The most commonest psychiatric disorder after the head injury. We will see here options. Option A, mania. Option B, schizophrenia. Option C, depression. Option D, phobia. Mania has also been associated with Traumatic brain injury means here option A is the correct answer. Diagnosis of mania following brain injury is based on criteria of mood disorder due to the traumatic brain injury. Manic features or with mixed features also we can see. Schizophrenia. Schizophrenia is a serious mental disorder affects a person's ability to think and feel and behave clearly. So, schizophrenia is not related to the head post injury disorder. What is depression? Depression we know. Depressed patient we are already seeing. Phobia. Phobia means a fear of the object or fear of person or fear of the some of the places. It is one of the anxiety disorder. So, here the commonest psychiatric disorder post of head after the head injury means mania. Next we will move on to question number 89. A patient with an alcohol addiction says, "My drinking is all my wife's fault. She makes me so crazy. I just have to have a drink." This is an example of from the options. We will see here options. Option A projection, option B denial, option C intellectualization, option D regression. We will see here options. What is projection? Projection means the psychological projection is a defense mechanism people subconstitutionally employ in order to cope with difficult feeling or emotions. What is denial? Denial is the conscious refuse the perceive that painful facts exist. Option C intellectualization means involves the person using reasons logic to avoid comfortable. What is regression? Regression is statistical technique that related to the dependent variable to one or more. So here option A projection is the example for the alcohol addiction says, "My drinking is my wife's fault. She makes me so crazy. I just have to have a drink." For example, option A projection. Next we will move on to question number 90. The first choice of drug for treating myocardial infarction. The first choice of drug treating for myocardial infarction. We will see here options. Option A streptomycin, option B streptokinase, option C NTG and option D heparin. NTG means nitroglycerin. Streptomycin is an antibiotic primarily used for the part of multi-drug treatment for the pulmonary tuberculosis. Next streptokinase is used to dissolve blood clots that have formed in the blood vessels. Treatment of acute ST segment myocardial infarction and depression, deep vein thrombosis and pulmonary embolism and arterial thrombosis. So option B is the first drug of choice for myocardial infarction is streptokinase. Nitroglycerin treatment episodes of angina in people who have coronary artery diseases also we can treat with NTG. Heparin is used to prevent blood clots from forming in people medical conditions. So here option B is the correct answer. We will move on to question number 91. The thymus related T cells. We will see here options. Option A produce antibodies, option B produce NK cells, option C recognize B cells, option D fight disease and infection. Thymus gland is located behind the sternum and between the lungs. Thymus is a small gland in the lymphatic system that makes a trained special WBC means white blood cells called as T cells. T cells helps to the immune system fight disease and infection. So here option D is the correct answer. Thymus gland produces most cells of T cells before birth. Thymus gland produces most of the cells T cells before the birth. So here thymus related T cells fight diseases and against infection. So here option D is the correct answer. Next we will move on to question number 92. Cardiac muscle differ from skeletal muscle by. The cardiac muscles differ from skeletal muscles. We will see here options. Option A in contain action and myosin. Option B it has atomicity and conductivity. Option C it needs here OT has come. It needs calcium for contraction. Option D all of the above. It has atomicity and conductivity is the correct answer because cardiac muscles differ from skeletal muscle means option B here applicable. Cardiac muscles are found in the heart and involuntary muscles, while skeletal muscles are attached to the bones and are the voluntary in nature. Cardiac muscle help in pumping of blood from the heart. On the other hand, skeletal muscles help in the movement and functioning of the body. So here the cardiac muscle differ from skeletal muscle by it has atomicity and conductivity. Option B is the correct answer here. Next we will move on to question number 93. The purpose of lymph nodes is to trap. We will see here options. Option A antigens, option B macrophages, option C hormones, option D RBCs. Purpose of lymph nodes is functionally lymph nodes is divided into T and B lymphocyte zones. Lymph nodes act as a filter. They trap or destroy anything harmful for the body does not need. Inside the lymph nodes are white bloods. Means the inside of the lymph nodes are white blood cells, also called as lymphocytes. These white blood cells attack and break down bacteria, viruses, damaged cells or cancer cells. So it acts as antigen. So here option A antigen is the correct answer. The purpose of lymph nodes is trap as antigen. Next we will move on to question number 94. Which one of the following statements by patient with backache should nurse alert? From the option, the patient is having backache. So, the nurse should alert. Options we will see here. Option A, pain on movement. Option B, pain radiating the legs. Option C, perineal anesthesia. Option D, pain sensation lost in feet. It is also seen in quadra equina syndrome, which includes secondary to a large disc herniations leading to the neuropathy. Perineal anesthesia is commonly defined as the loss of sensation to the area of the buttocks, perineal space and thighs. So here option C, perineal anesthesia. The following statement by patient with backache should alert nurse. Perineal anesthesia is the correct answer here. Option C. Next we will move on to question number 95. H2 blocker of choice. H2 blocker of choice in liver disease is. H2 means histamine 2 blockers of choice in liver disease. We will see here options. Option A, cimetidine. Option B, ranitidine. Option C, famotidine. Option D, nizatidine. See which drugs are used for the liver disease. Before that, we will see all of the drugs. Cimetidine. Cimetidine treatment for the, it is the one of the H2 blockers used to prevent and treat symptoms of heartburn associated with acid indigestion. So here option A is not applicable. Next, what is ranitidine? Ranitidine is a H2 blockers, prevent heartburn and prevent more serious ulcers in the stomach. So this one also not applicable. Option C, famotidine. Famotidine is also one of the H2 blockers, prevent heartburn, prevent more serious ulcers in the stomach. So this one also not applicable. So here option D is accepted. So option D is accepted means H2 blocker of choice in liver disease is nizatidine. We will see in detail about nizatidine. Nizatidine is a histamine type 2 receptor antagonist which is mainly used for the treatment of acid peptic diseases and heartburn. Nizatidine has been linked to rare instances clinically apparent acute liver injury. So here option D is the correct answer. Next we will move on to question number 96. A nurse caring a patient on pancreatic enzyme replacement therapy should assess them for. Patient is an replacement of pancreatic enzymes. Nurse should assess for them. We will see here options. Option A, weight gain. Option B, hypertension. Option C, arrhythmias. Option D, GIT irritation. GIT means gastrointestinal tract irritation. So pancreatic enzymes can help manage the symptoms like weight loss or diarrhea. Most frequent side effects are constipation, diarrhea and nausea abdominal discomfort. So in these cases, nurse should be concerned about weight gain. So option A is the correct answer. A nurse caring a patient on pancreatic enzyme replacement therapy should assess them weight gain. So option A is the correct answer here. Next we will move on to question number 97. Cytokinase are chemical messengers which? The cytokinase are chemical messengers which are the following. We will see here options. Option A, kill microorganisms. Option B, promote inflammation. Option C, cause severe pain. Option D, produce antibodies. The cytokinase are the primary chemical messengers involved in both acute and chronic inflammations. So cytokinase are chemical messengers which is kill microorganisms. So here option A is the correct answer. The cytokinase play main role in inactivation of immune system. Means the cytokines play main role in activation of immune system also. Here option A is the correct answer, kill microorganisms. Next we will move on to question number 98. Nurse has to apply erythromycin ointment to a newborn child. Which area of eye she is supposed to place it? So here nurse have to apply erythromycin ointment to a newborn child. Which area of the eye nurse supposed to place the erythromycin ointment? We will see here options. Option A on the cornea. Option B under the eyelid. Option C lower conjunctiva. Option D upper conjunctiva. Newborns receive erythromycin eye ointment after the birth to prevent pink eye in the first month of life, also called as ophthalmia neonatum. Ophthalmia neonatum condition. To apply erythromycin ointment to a newborn child, nurse can apply under the eyelid to treat eye infections like, for example, conjunctivitis. So here the nurse has to apply erythromycin ointment. A newborn child is under the eyelid. Option B is the correct answer here. Next we will move on to question number 99. All are the true regarding H. pylori infection except. From the options, all are the options are correct, means true related to the H. pylori infection. One is the except condition. We will see here option. Option A, it is a gram positive bacteria. Option B is a eradicated by triple therapy. Option C, produced erases enzyme. Option D, causes of myeloma tumor. Helicobacter pylori. Helicobacter pylori is a bacteria that causes peptic ulcer. H. pylori is a gram-negative spiral shaped bacterium that causes peptic ulcer. So here there is option A, gram-positive bacteria. So gram-positive bacteria is not correct. H. pylori infection is caused to the gram-negative bacteria. So here option A, gram-positive bacteria is except. Here true regarding H. pylori infection is eradicating by triple therapy, produces urasis enzyme and causes myeloma tumor. Next we will move on to question number 100. This is the last question in this video, model paper regarding staff nurse in previous years. How a nurse will have to collect urine sample for culture from urinary collecting system. It is having catheterization, means urinary catheterized. Patient is catheterized. The nurse should have collect for the urine culture sample. How she have to collect? We will see here options. Option A, with needle aspiration. Option B, empty urine from bag. Option C, collect from catheter. Option D, disconnect bag and collect. Culture sample means it is we have to maintain full of aseptic techniques. Clean the catheter port with a 70% alcohol swab by using a sterile techniques. The nurse will puncture the collection port with a needle attached to the syringe, aspirate the urine and place it into the sterile container. So here with needle aspiration, option A is the correct answer. Empty urine from bag, collection from catheter, disconnect bag and collect. These all are the aseptic techniques to collecting a urine sample for a culture. These all are the aseptic techniques. So here option A, with needle aspiration we have to collect urine sample for culture with full of sterile techniques. Option A is the correct answer, with needle aspiration. This is the previous year model paper from this nursing staff nurse MHRB previous year model paper. Till now we discussed 100 questions related to the model paper. Next class we will discuss the subject of psychiatric nursing. Related to the psychiatric nursing we will discuss very important and frequently asked questions in the previous years. Also we will discuss in the psychiatric nursing point of view next video. So stay tuned friends. Thank you for watching my video. Those who are watching my video, please like a video, please give a comment, and anybody watching first time my channel, please subscribe my channel. Click on the bell icon for further notification. Like a video and please give a comment. Thank you for watching my videos. Thank you.